What are the best exercises for shoulder impingement? If you have shoulder impingement, you may have pain with things like reaching over your head, reaching across your body, or reaching behind your back. And chances are that if you're watching this video, you want to find some exercises that you can use to relieve your shoulder pain. I'm Dr. Dave Candy, and in this video, I'm going to explain what exactly shoulder impingement is, what causes it, and 9 different exercises that you can use to relieve it without needing any type of equipment other than a towel. But chances are you probably don't even need to do all 9 exercises. For most people, just 2 to 4 of the exercises work really, really well. But to help you better decide which ones are going to work best for you, I want to start out just explaining what exactly shoulder impingement is. So shoulder impingement really just means that there's a narrowing of the space or an impingement of the space where your rotator cuff tendons run. And your shoulder is like a ball and socket joint. And when you move your arm, that ball rotates in the socket. Now, over top of that ball and socket joint, there's an arch of bone and tendon, and the rotator cuff tendons run through a little 1 centimeter space over top of that joint. And if you have either bone spurs or if you have poor posture, that narrows that space even more so. And so your goal with your exercises for shoulder impingement is to maximize that space available so that you don't pinch your rotator cuff tendons or your bicep tendon or the bursa in your shoulder as you're moving your arm to do your various activities throughout the day. So the first exercise is to get better mobility at this ball and socket joint in your shoulder. That to be able to move smoothly as you're going to reach upwards or across your body or behind your back, you need to have good mobility at this shoulder joint. And so to do that, you want to make sure that you have enough flexibility in the back of the joint. If the back of your shoulder joint is too stiff, then the ball will tend to ride either forward in the socket as you're reaching across your body or reaching behind your back, or it'll ride up in the socket as you're raising your arm up. And so there's an exercise called the sleeper stretch that helps focus on the flexibility or mobility of that back part of the shoulder or the posterior capsule. So here's how you do the sleeper stretch. You'll lay on your side like this, and the classic description of the sleeper stretch is just to press your arm down like that. But if you already have shoulder impingement, you can actually pinch or impinge on the space where the rotator cuff tendons run as you're doing this exercise. And so that can actually create some shoulder pain. Now, a way that you can keep that ball from pinching on those tendons as you're doing this exercise is just to use your opposite hand and put a little bit of pressure right on the ball. And so you're pressing down with your top hand, and then you're taking your involved or sore arm and bringing it down this way. Now, since you don't have your hand available to stretch, place this elbow over top of your wrist and then hold just a gentle pressure there. You don't need to push as hard as possible. Just go till you feel a gentle stretch in the back of your shoulder. Now, this is really to address the capsular tissue in the back of your shoulder, and capsular tissue doesn't stretch out quickly. So you don't want this to be an extremely hard, aggressive stretch. This should be a slow, gentle stretch where you hold just a sustained pressure over a long period of time. Some research has shown that it's supposed to be up to 20 minutes or so, but that's a long time to stretch. So start with 5 minutes. If you can work up to 10 minutes, that's great, but just do a very gentle pressure that you can hold for several minutes. So after you've got the mobility of your shoulder, next you want to improve the motor control. And what I mean by motor control is coordination. Coordination is the ability to move and rotate the ball in the socket without getting your shoulder blade involved or allowing your shoulder to tip forward. Now, a lot of classic exercises for shoulder impingement involve doing internal and external rotation exercises like this, using an elastic band, but there are a couple problems with that. One is that most people don't focus a lot on the control aspect. They just focus on strength. And so people will a lot of times allow their shoulder blade to get into the movement, doing it mindlessly. Now, if you are going to do that exercise, I would recommend putting a towel between your shoulder, keeping it nice and still, and rotating just in and out at the ball and socket. But really, most shoulder impingement problems don't happen with your arm down here by your side. They happen when you're up at shoulder level. And so to do that, you want to improve the control, not necessarily the brute strength, but the control and the coordination of your arm up at 90 degrees here. And so there are a few different ways that you can do that. Starting out, the easiest way to do that is laying on your back and propping your arm up on a towel. It is important to have your arm propped up because if your elbow drops back this way, it kind of pushes the ball forward in your shoulder socket. So you want your elbow to be at the plane of your body or just slightly above towards the ceiling. Then you're going to practice rotating your arm back and forth as far as you can go. Now you'll notice with this hand, I'm placing it on the front of the shoulder joint. You don't want to allow the ball of your shoulder to pop forward or for your shoulder blade to tip forward. And so you're not actually holding with this hand, you're just feeling with your fingers and making sure that that ball and socket stay nice and still. So it's just a pure rotation of your arm. Picture an axle running through your upper arm bone, and you're just rotating your forearm back and forth around that axle. And so that's the first exercise. Now, the second exercise is actually very similar to that, but in this position, the hardest parts of the motion are back in this range and back in that range. This is pretty neutral, right in the middle of the range of motion, but the two end ranges are the areas where your muscles are the weakest. In the position where you're laying on your back like this, gravity's helping you at both of these end ranges. So to make it a little bit more difficult, if you flip over on your belly like this, now gravity's helping you in the easiest part of the motion, and at the hardest parts of the motion, at full external rotation and full internal rotation, you're actually fighting against gravity. So there's a little bit more of a strength component to this, along with the coordination. Now you'll notice that I took the towel and I placed it in front of my shoulder here, and that again helps keep the elbow in front of the plane of the body and doesn't allow the ball of the shoulder to glide forward in the socket. And then it'll be the same sort of movement pattern, pretending you're rotating through the upper arm bone and just going back and forth. Now you'll notice that the range of motion is a little bit more limited here because gravity's not helping. Now you can get farther if you allow your shoulder blade to get into it, but you don't want that. You just want to rotate purely around the upper arm. For the third shoulder rotation exercise, you're going to stand with your back up against the wall, and then it's the same general movement pattern, just back and forth like this. But now you have to hold the weight of your arm up against gravity and still rotate at the same time. Now, to increase the difficulty of this, remember from physics that force is mass times acceleration. So after you've got the motor control down, if you move faster, that will increase the difficulty of the exercise. And if that gets too easy, you can add a water bottle, a can of soup, or a small hand weight to help increase the difficulty of the exercise. So those were the exercises to focus on the ball and socket joint. Now next I'll transition into exercises to address the movement of the shoulder blade on the trunk. Now notice as I raise my arms up, the shoulder blades have to kind of move away from the spine and out to the sides. And what that does is it raises the arch of the shoulder up so that the ball doesn't ride up into the top of the arch. Now you need to have good flexibility in your chest muscles as well as in your lat muscles in order to allow that upward rotation to happen. And so first I'm going to discuss some flexibility exercises that you can use to improve your chest flexibility as well as your lat flexibility. So the first one is easiest to do in a doorway. Stand in a door like this with your arms upwards, and then you want to slowly walk in. You don't want to lean forwards on the doorway because then your arms are doing the work of holding you up while you're trying to stretch them. So you want to be able to freestand in the doorway. Start with your arms on the doorway and then just take a small step in. But you should be able to, at any point, remove your arms from the doorway and not fall forwards. So you start there, you just walk into the doorway and then hold that stretch. If you're through the doorway and your chest is in front of your elbows, chances are you probably don't need to do this exercise to begin with. So you don't want to really lean far into the doorway. You should get at most equal to the doorway. And so that is a stretch to help improve both external rotation at the ball and socket joint, as well as chest flexibility and posterior tipping of your shoulder blade or backward tipping of your shoulder blade so that it raises the arch of the shoulders up in this direction. And so again, arms up on the doorway, small step through, and then just hold a gentle stretch. About 1 to 2 minutes, just a slow, sustained stretch. Now, a progression on that is just to do the same exercise without a doorway. So now you're stretching your chest muscles, but you're also strengthening your upper back muscles as well as your rotator cuff, your shoulder external rotator muscles. So you are getting both flexibility in your chest as well as strengthening in your upper back when you're doing this exercise. And if you can do this, if you can keep your arms back like this up against the wall pretty easily, then just start to slide your arms up a little bit. Now, notice your elbows should not be back on the wall when you're doing this, because if you can get your elbows back on the wall, chances are you probably don't need to be doing this in the first place. You should have more external rotation in your arms and focus on bringing your wrists back to the wall, but the elbows will probably be slightly in front of the wall. And that gives you more external rotation when your elbows are in front of your wrists. So that's the second flexibility exercise for your chest. Now, while you're up against the wall or up against the doorway, you can do another exercise with your back up against the wall, which actually helps stretch your lat muscles. And to do that, you're going to put your arms like this, where your forearms are parallel and vertically facing. Now you're also getting external rotation of your shoulders. So again, you're strengthening your rotator cuff muscles at the same time without needing silly rubber bands. So you put your arms up like this and then slide up towards the ceiling only as far as you can without letting your arms come in like this. If your elbows flare out, you're going into internal rotation, which is part of that shoulder impingement position when your arm comes into internal rotation, adduction, and flexion. So you want to keep that external rotation of your shoulders, keep the forearms parallel, and only go up as far as you can without allowing that internal rotation. So that's an active lat stretch that you can do if you do have shoulder impingement. And that would be best if you have trouble with things like reaching upwards in front of you. If you have trouble more with things like reaching out to the side, then perhaps this exercise, like the chest stretch, would be better for you because it's more in that out to the side plane. Now, the final two exercises that I'll show are similar to what I just showed, but they'll be facing the doorway. So the way you do that is to put your arms up on the door, lean into the door, and then slide your arms upwards, again trying to keep your forearms parallel. You're kind of putting a little bit of inward pressure into the door at the same time, which gets a muscle under here called your serratus anterior activated. That muscle is responsible for helping to move your shoulder blades up and out as you raise your arm up over your head. So to see a side view of that, you're kind of pressing into the door and then sliding your arms upwards on the door. Now, if there is a little bit too much friction between the door or the wall, or you just don't want to mess up your paint, you can use that towel that you used before and just slide the towel up the wall. Now, the last exercise that I'll show is similar to the serratus anterior slide on the wall, except you're going to go up on the wall, kind of out at a Y. So go out in a Y, and then do a slight lift off. Now that lift off isn't from the shoulder joint, it's actually tipping your shoulder blade backwards like that. So it's more a shoulder blade tip than it is an arm rotation. So slide out like a Y, and then do a slight lift off like that. And that activates a muscle down in the lower part of your shoulder blades called the lower trapezius muscle. Now that's helpful for someone who tends to have high riding shoulders, where you sit with your shoulders shrugged up all day. You may even have some stiffness in these muscles up here. You notice when you go to reach for things that you overactivate these muscles up here. Those lower trapezius help to upward rotate your shoulders while also keeping you from shrugging up too much. So those were the 9 different exercises to help if you have shoulder impingement. And just to review those were the sleeper stretch to improve the mobility in your shoulder joint, the 3 forms of shoulder rotation, laying on your back, laying on your belly, and then standing up against a wall like this, the chest stretch in the doorway, the chest stretch with your back up against the wall, the lat stretch with your back up against the wall, the serratus anterior slide facing the wall and pressing into it, and then the lower trapezius slide going out like a Y, and then doing a slight lift off. And so those were the 9 different exercises. Now, if you aren't sure which exercises are best for you, or you have a more complex problem that you need addressed, or if you just like to get things feeling better as quickly as possible, and you don't want to go about guessing and checking and possibly making some mistakes on your own, we'd be happy to help you out here at More for Life. Just contact us through our office, and we'll get you set up with an appointment. And if you're watching this from somewhere else, but you found it helpful to better understand shoulder impingement, as well as some exercises that you can use to improve it, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.